We welcome our chief guest speaker, Dr. Sitesh Roy. Please welcome him to the meeting.
तुम्हाला अरे बाबा तुझं तो रेकॉर्डिंग वाला पण बघून गेलो तो बोला मी तुमचं कामी काय करू दिलं बघूया नमस्कार.
Well, on behalf of the club, we express our joy in welcoming them.
Good evening, ladies and gentlemen. Thank you for inviting me to speak to such an esteemed audience today of Rotarians here. I appreciate this opportunity to share a little bit of what has been my passion over the last 10 years with you all. As I entered the field of medicine, almost 22 years ago now, I came into it with an idea that I would be helping people cure their diseases, actually get rid of their problems. And very soon, probably within 4 or 5 years of starting, I realized that I was not actually achieving my dream. I was seeing the same people over and over again. I was prescribing medicines day in and day out. I was able to control their problems, but I was somehow not being able to cure their problems. And I think many people will relate to this from the fact that from the time we walk into a doctor's office with any symptom, to the point that it takes 5-10 minutes of a busy doctor's time, we walk out with prescriptions. We are often not smarter, not more well-versed about what actually is wrong with us. Often it is lack of time for the patient, sometimes it's lack of time for the doctor. But whatever the reason, it seems like painkillers, antidepressants, anti-anxiety pills, all of these have become very commonplace in their use. And as much as we wish that patients would realize what really happens to them, that people would realize what really happens to them, we don't have the time or the energy or the resources sometimes to help them figure out what actually is going wrong. When I started retracing my path backwards, looking at ancient medicine, looking at ancient healing techniques, it was fascinating for me to realize very quickly, working and meeting some of these people from around the world, both in the US and during my frequent trips back here to India, that simply by visiting some of the doctors who have been in practice for a very long time, patients walk away feeling better even without a prescription. In today's medicine, we call it placebo effect. There are billions of dollars worth of medical trials that are done around the world on the most fascinating medicines that are created, including in the field of allergy, asthma, and immunology, where we figure out that during the trial, the placebo arm, some people call it the sugar pill, it's not as simple as that as you can expect. In that arm of the study also, up to 25 to 40% people get better, just as much better as the actual active drug makes them. And this is an area of research which I know personally because I have applied for grants to this and been granted some by the NIH in USA. They have millions of dollars that have been chartered or set aside for research into how does the placebo effect work. And interestingly, some of the earliest research that's coming out from this field is showing that just the visit to the doctor's office or the medical center, just the time taken by the staff there to ask the patient, how are you feeling, what is going on in life, what has been your sleep quality, what has been your day-to-day life quality, just that part of the counseling has been adequate to make the patient feel a whole lot better. And so that made me realize the power of the art of counseling in modern medicine, which often, even as a physician myself, I find myself struggling to do with patients. And with that, it made me really aware about the connection between mind-body, which has become a very common term in modern day medicine, mind-body medicine, where every disease that you can think of ultimately has a connection to the brain, the nervous system, the person's psychology, emotions, relationships, everything else that you can think of that impacts a human being. Because we no longer look at a person as just a body. The physical symptom that manifests in a person, whether it is a simple headache or a stomach upset, which is what most people in a busy city life like Mumbai will experience, to me now it is a signal, a red flag, telling us that there is something going on in the body that is not right. Rather than looking at it as a symptom for which we quickly prescribe a paracetamol, a crocin, an ibuprofen, or an antacid or a proton pump inhibitor, something that will suppress the acid and take away the pain, if we were to figure out why did the pain occur in the first place, that would probably make us sit back and identify where this red flag is coming from, where is this being triggered from. And that takes us to the core of today's talk, which is stressors. Everything in modern day medicine, when you look at the list of causative reasons, somewhere in the list you will find a stressor. Now, most of us think of stress as mental stress, but the reality is that stress is not just mental stress. There are physical stressors. If someone has to carry a heavy weight and walk long distances or long hours, that's an example of a physical stressor. If someone has to travel through Mumbai trains or buses in the peak hours, that's a physical stressor. If someone has to experience wide fluctuations in temperature, barometric pressure, which can occur during season changes, which is a classic trigger for asthma in patients, those are physical stressors. Then we talk about chemical stressors. Chemical stressors start from the time we wake up in the morning. From the very first toothpaste that we put in our mouth, not realizing that there are on an average 10 to 14 chemicals that are in it, which unfortunately, this is the reality of modern day, even the FDA does not know what chronic exposure to some of those chemicals will do to the human body, but has been labeled as innocuous or non-harmful. We start brushing, we start shampooing, conditioning. We start applying perfumes, colognes, deodorants, body sprays. If you ever read the list of chemicals that are on these bottles, and you happen to go and then look at each of those ingredients on the internet, I'm not saying go to any medical textbook, go on the internet and find out what chronic exposure does from these chemicals, you will realize the degree of chemical stress that the human body is exposed to. It is mind-boggling. You add to that what we commonly recognize, pollution from industries, pollution from vehicles, pollution from just burning unhealthy products in the environment, whether it is large piles of garbage that contain plastic and thermocol, two of the most toxic chemicals that can be released into the environment. And you will realize the amount of chemical stressors we are faced with. You then take this a step further and come into the more hard to measure mental stressors. Mental stressors of achieving whatever it is that we are doing in our day, whether it is trying to catch a bus, train, or reach a destination for a meeting on time and the mental stress that causes us, or the mental stress of trying to achieve a target or a goal that we have set ourselves, whether it is within a day, a week, a month, or several years, or a lifetime. And we easily recognize the mental stressors, the common things that give us a tension headache at the end of a busy, hectic day. On top of that, you add emotional stressors. Stress that we commonly experience starting from within the family, between a husband and a wife, or between parents and children, or between other family members. And you will realize what emotional stress is like. Some people have called it in movies or other arenas emotional atyachar. Sometimes can be very innocuous. A simple statement made by a family member can set us thinking the entire day, or week, or month. Emotional stressors. Leave all that aside. I'll now tell you about a level of stressors that is a modern day phenomenon because we lead very busy, fast-paced lives these days, and that's spiritual stressors. Baba comes on TV and says you must do pranayam every morning. We don't find the time. Deep down we start feeling guilty about it. Spiritual stressors. Someone says, read this spiritual text or that spiritual text, attend this conference or that conference, go and do this course or that course, and you find yourself having a hard time attending everything that is out there to help you do better in life. Spiritual stressors. Interestingly, every single form of stress that we are exposed to creates the same response or the same mechanism in the body that I will now outline for you. In ancient days, when stress was given in our system, it came down, whether you call it through the ancestors or whatever form of evolution you believe in for human beings, it was given as a flight and fright phenomenon. Let's say the ancient man living in a jungle, hunting for food, suddenly realizes that there's a carnivorous animal running behind him or attacking him. The kind of chemicals that would be released in his body, adrenaline, cortisol, is what helped him run for his life so he could save and survive to see another day and take care of his family or his social network or whatever it is that he was living in. This fight and fright and flight response, which releases these powerful chemicals that are meant to drive the heart rate at a very high level, meant to drive the breathing, tense all the muscles, get them ready to do whatever it is that you're trying to do, has a very good reason to be in our system. And interestingly, these same chemicals, when they are released on a chronic basis, every single day, now with tiny events or elements in our life that may even be at a mental or psychological level, now recreate that entire cycle again in our body. Adrenaline, cortisol. Producing the same flight, fright, fight response in our body, which we face sitting in our comfortable chairs, sleeping sometimes in our bed and worrying about things, taking stress or tension in events where we can't really move and express that we are tense. And what does that end up with? Cold hands, cold feet, sweaty palms, jitteriness, tremors in the voice, constant shaking of the leg, hands. These are common things that we'll see people do all the time. Those are all the effects of the adrenaline that has nowhere to go and is working on every organ and system in the body, trying to push it into hyperdrive, thinking that something really bad like a tiger or lion attacking it is going to happen, when in reality none of that is true. It's all up here. And interestingly, when you look at these same hormones and you look at the mechanisms for the diseases that are ravaging people these days, hypertension, heart disease, heart attacks, strokes, diabetes, you will find that these hormones are at the very source, the very core when the disease first begins. These are the mechanisms, and when these begin, as an immunologist, I know what they do to the immune system. The immune system then has to find targets where it can go and attack something. It starts attacking itself. It starts attacking its own blood vessels, making them harder and tighter, causing hypertension. It attacks its own organs, causing autoimmune disease within diabetes. It makes the person so anxious, so worried, so unable to release their stress, then they start eating things that give them the same satiety in the brain that they would get from probably calming down and realizing what is really happening to them. That causes obesity. And with obesity comes every other disease that you can think of. Arthritis, hypertension, diabetes. And with it, as we realize in the field of allergy, immunology and asthma, allergies and asthma start rising. Immunologically driven diseases that cause inflammation in the body, triggered by elements in our environment that are completely innocuous. A simple dust mite that has been living, cohabitating Mother Earth with us for millions of years, suddenly becomes the worst enemy for a person who wakes up sneezing, coughing, having a hard time breathing, or breaking out in rashes, breaking out in hives. Foods that were supposed to nourish us, milk, wheat, soy, peanuts, suddenly become life-threatening allergies that the moment they enter into your bloodstream, they cause a violent reaction that can kill a person within minutes. All because of the immune disharmony, imbalance that was all triggered by variety of stressors that the body was exposed to. Physical, chemical, emotional, mental, psychological, spiritual. Now with these stressors, when they enter into the body in different forms, these different chemicals that are released from within the body, adrenaline, cortisol, and all the other cascades and pathways that come following it, they end up accumulating in the body. What we call in these days as toxins. Toxins that don't always get identified on a blood test or a blood report. After I started getting interested in this field, I came to realize that the common tests that we do, CBC, blood count, liver profile for liver enzymes, kidney function tests, they really go wrong very late when the organ has been damaged to a very significant level. We all know that the liver has up to 300 or 400% reserve function. When it gets damaged to that level where 200-300% of its function is gone, is when you start seeing the elevation in the enzymes or other problems. So we've been given tremendous amount of buffer by nature to take action when the symptoms are still in the early stages. Lethargy, weakness, nausea, headache, joint pains, aches and pains, tiredness, fatigue. But we tend to keep pushing our bodies, going through it day in and day out, till ultimately one organ breaks down and we are forced to go take that attention or notice and do something about it. And within these systems, where these toxins are building up, they begin very early in life. There was a time when in the field of asthma, we used to say that you can't make a diagnosis of asthma in a child below 4 years or 3 years of age. Today, the international guidelines that are being followed say that you can make diagnosis of asthma in a 6-month-old baby. There have been interesting research done where they've actually gone in and biopsied the lungs, taken a small piece from the lung of an infant who's been wheezing, and shown that they have the same degree of chronic airway remodeling that would be seen in a 40-year-old who's been suffering with asthma for 20 or 25 or 30 years. The point I want to make here is while there is a lot we can do for ourselves where we are at what stage in our life, we also need to do a lot for our children. Because our children are our future, we know that. And a lot of this damage begins very early in life these days. Very early in life. In fact, sometimes even before life begins, within the parents who are thinking of conceiving a child. I recently did an interview with Life Positive magazine. They approached me because they knew I had an interest in stress immunology, which really has a role in every single disease in today's day and age. And they wanted to ask me about declining fertility and declining sperm counts in the world. Worldwide, this is a phenomenon. And you all may have all seen a movie that recently came out. It was called Wiki Donor, in which if you hear one of the main causes that he says infertility is occurring, he says stress. Everybody is in so much stress that there is dispassion in life. People are depressed. They don't understand and enjoy life anymore. Even conceiving a baby, which seems to be the most basic human function, infertility rates have doubled or tripled in the last 20 to 30 years. According to some international numbers. There may be some different numbers from other parts of the world. And within that, when I did the interview with them, some of these things were discussed where we spoke about the physical, chemical, emotional stressors that a mother is exposed to before pregnancy, and then what the father is exposed to and how these affect the offspring, and how these counts, which used to be above 100 million, now hover around 40 to 50 million, half of what they used to be 60 years ago. So a very fascinating thing, again, showing that this is not just about hypertension, diabetes, kidney disease, heart disease, allergies and asthma, but it's also affecting basic core functions in our health and our body. And with it, the children that are being born, more and more, I'm a pediatrician also by training, before I became an allergist, immunologist, and took care of both adults and children, because it's a cross-training board in United States of America. We find that kids more and more these days are getting diagnosed with attention deficit hyperactivity disorders. We call them hyper children. We like it. They say they are very energetic. They have a lot of intelligence. They pick up things, they absorb it like a sponge. But they actually have such hyperactive minds that by the time they are teenagers, they're often going into smoking, drinking, drugs of abuse. Before you realize it, they're damaging themselves because they can't control the hyperactivity of their mind. This is one example. We also figure out that they're getting glasses earlier than usual. They're developing asthma allergy earlier than usual. They're getting autoimmune diseases earlier than usual. So the damage begins very early. From the stage that it is an egg and a sperm, to the time that it was an embryo and a fetus, all the way to the point that it becomes a newborn healthy child, these things are working on them. And unfortunately, unless we wake up and start looking and critically analyzing our lives and trying to figure out where all do we need to make some change, whether it is at the thought level, whether it is at the physical level, whether it is at the perceptual level, we won't be able to make a difference. Detoxification is a very powerful process. These days, a lot of alternative medical centers are talking about it, and genuine and true detoxification to get many of these chemicals out of the system so that the system can again come into an equilibrium and function normally. It's a very critical part of medicine, but in modern medicine I find that though I have the very best drugs to treat every symptom that you can think of, I don't really have too many medicines for detoxifying the body. And again you find yourself having to retrace your path back to ancient medicine, to alternative medicine, to alternative techniques, to ancient lifestyles sometimes. People will take a 15-day break and go off to a center to rejuvenate. The center rejuvenates you, but what happens when you come back into your normal life? Back to square one. It hardly takes time. If anyone here has ever gone for a full body massage and knows the experience of the relaxation that they feel after it, and how quickly after they go back into their routine life, they find that did I really get a massage? And so recognizing these things and identifying them, having a physician who can take some time to talk to you, to understand where your problems lie, where the root cause is, not where the superficial symptoms are. We are excellent at giving drugs for symptoms. But what happens? The person gets used to having those medications. My patients ask me, will my child become addicted to this inhaler? I tell them that there is no addiction property in the inhaler, but unless you figure out the root cause of why the allergy and the asthma develop, your child may not be able to function without the inhaler. There's a difference between addiction, where you can't do without it because it caused you to become addicted, and you can't do without it because your symptoms come back and the inflammation comes back because you don't use it. And I find counseling these parents or grandparents about healthy lifestyle for the child. Children these days sit with their PSPs, their Nintendo games, never to see sunlight. The biggest epidemic right now in the world, if you know, is vitamin D deficiency. And you know where it comes from? Sunlight. Isn't that sad? There was a time in our ancient medicine where we would say, Hawa hi dawa hai. Go out into the open air, play, run, exercise, enjoy life. Get sunlight, get fresh air. You'll tell me, where do you get fresh air in Mumbai? There are certain segments of time when the pollutants are less than others. Meet me later, I'll talk to you about that. If you try to jog at 5 p.m. in the evening, you're probably better off not jogging. Because the kind of stuff that will go into your lungs will unfortunately inflame and damage it. Over time, not immediately. It's still a better habit if you're protecting your heart, your circulation, your lungs. So recognizing what to do, when to do, how to detoxify the system. Stress is not going to go away. I realized that when I took on this passion of mine to speak, do lectures, create awareness, do health camps with groups of people that are truly interested, I was putting in 17, 18, 19, 20-hour days, both in America and here. And I put it upon myself to lead a lifestyle, change my diet, change my health in such a way that even at the end of an 18-hour day, I still felt energetic, alive, vibrant, healthy, because I knew that there are people who are depending on me, my patients, or people that I'm counseling around the world. I have entire families, right from the baby to the grandfather or great-grandfather, who take counseling from me. Not just on health, but on every aspect of life, because they start with health and they soon realize that health is an end effect of all the other things in life. Relationships, finance, stressors, in every aspect of life. And if you cannot handle all of those, health is just the end result. Yes, genetics is a very big part. I know it from my field too, that what you're born with is 50% of the diseases that you will face, but the remaining 50% is still environmental. We can't make a change to our genes, but we can make a change to our diet, lifestyle, thinking patterns, health, whatever format we might choose. and whichever way we might choose to do it. And so creating that awareness, recognizing that the importance, the value of understanding what our body is trying to tell us. There are a lot of people trying to do campaigns on a mass level. I try to do campaigns on an individual level. One person at a time. Because each person is so unique. While I have one paracetamol or one ibuprofen that I can prescribe to 1 million people for pain and expect a result in the large majority of them, as long as it's not a severe disease, what that doesn't take into consideration is every human being is unique. And interestingly, modern medicine, the future of modern medicine, is going to a field called pharmacogenomics. Where literally the moment you walk into a doctor's office, they will draw a blood sample. This will happen 25 to 50 years from now. They'll draw a blood sample from you and identify what your pharmacogenomic profile is. Then they will smartly prescribe drugs that will be good for you and won't damage you. And they learned this the hard way after more than 100 years of allopathic medicine. That they figured out that the same medicine given to one person works, doesn't work in the other, or causes serious side effects in one person, while it works beautifully and wonderfully in another. Whereas our gurus and rishis knew this 5,000 to 10,000 years ago. They used to do a simple nadi pariksha, and they used to make customized supplements or medicines for people. They knew then that the same formula won't work for every single person. Otherwise, they would have opened pharmacies and sat, but they didn't. They opened gurukuls to train and teach people how to live life, how to enjoy life, how to celebrate life, and stay healthy. In fact, if someone had to go to a Vaid in those days, it was considered a huge problem. They had to wonder what paap have they done in their life, what sin have they committed, that they are now having to go see a Vaid or a doctor. In today's day, I know as a fact that 35% of children in America, where I've practiced longer than I've practiced in India, are on some form of chronic medication. These are kids below 16 years of age. We don't think twice about what's happening. We are so engrossed and involved in whatever it is that we are doing that we don't take the wake-up calls, the wake-up signs. And sometimes if we do, we don't have the resources to deal with them. And so recognizing each individual in their own way, figuring out what is it that my physical body is telling me, and hence what is it that my mental body is experiencing, and what is it that I am then bringing into my life or creating in my life. With each event that occurs to us, we are given a chance by our body to make a change. But we try to take the easy way out, we pop a pill and we try to suppress the symptoms, go forwards. Ultimately it ends up in a serious ailment or death or in an organ transplantation or in a surgery that becomes non-optional at a certain point. Preventive medicine, even the way it is practiced right now in the US, happens to take care of a portion of the disease. I'll give you another example of how this works in our life. We tend to eat the same food that we like or enjoy based on our taste throughout the year. When in reality, the foods that we were designed to eat change with seasons, change with weather. We have forgotten that art, we have forgotten that science. A certain food eaten at the wrong time of the day or in the wrong season can itself cause a tremendous amount of inflammation, irritation, acidity, whatever you want to call it, in the body. And so many a times the general masses, the statements that are made, we have to retract it in modern medicine after some time. Where we used to say that all unsaturated fatty acids should be polyunsaturated fatty acids. Then we went to realize that no, mono are also important. It needs to be a balance. Then we realized about trans fat, but these data came all at the interval of 5-10 years. But at a point of time, what was best is no longer best. So even in modern medicine, we are changing. Even our knowledge about diet and lifestyle is changing. Food is medicine, anna bhagwan hai. Something that was written in our Shastra, something that was written in our ancient texts. We don't see it these days. We don't practice it these days. We eat what pleasures the tongue. We eat what pleasures the mind. But we rarely think of what pleasures or what takes care of, rather, repairs, rejuvenates, heals not just the physical health, but also the mental health and the spiritual health of a person. As I did research in this, I came to realize that modern medicine is coming back and looking at things in the same way. Quantum physics, one of the most advanced forms of physics, is now coming back to spirituality to find answers. Same way modern medicine, the people who are doing the highest level of psychiatric medicine are coming back to spirituality, to physical exercises, healing techniques, ancient forms to find answers. Because they've realized we've gone to the very core, the very depth, the most minute mechanism of why the disease is occurring, we know in modern medicine. The single chemical, the single pathway that goes wrong, we know, but no one can answer why it went wrong. We blame it on genetics, we blame it on the environment. So having recognized all of these factors, like I said, what I started incorporating in my own practice with my own patients is creating a sense of awareness through counseling. It takes time, ability to talk to the patient, find out what they are eating, drinking, what their lifestyle is, what their family relationships are, how is it that they are manifesting these symptoms, where do these symptoms actually point to. Very often, I'll give you an example. When there is a migraine headache, you go to a specialist, they will treat you for the migraine headache. They will treat you for an imbalance in a certain chemical in the brain that causes the blood vessels to constrict and then dilate, causing a throbbing headache that can last for days together, sometimes completely impairing a person. When in reality, the source, the cause, the origin of migraines actually lie in the gastrointestinal tract. And that way it really opened my eyes when I started going into the deeper aspects of every disease to figure out what is the real source of this symptom or this problem. And I was fascinated to realize that this system is the central ministry for the whole body. And unfortunately, everyone living in Mumbai is experiencing problems in this system. Every single person. I am yet to meet a person with a perfect digestive health. Because that's the first area that gets damaged or attacked because of the food we eat and the stress that we take. And from there, as the toxins spread to the entire body, different diseases are manifested. Now, what I'm calling toxins, modern medicine uses many different names. Cytokines, proteins, antibodies, leukotrienes, many different names, prostaglandins, but they have an effect in the body that creates the same kind of effect that you would see when a toxin was taken. When they go beyond a certain level, they all have a positive role in the body also. So recognizing the importance of counseling, the time taken to understand each individual, what they need, how they need, when they need it, diet that has to be individually created for the person, lifestyle that can be modified so that they achieve the highest potential that they can in their life, and then into the psychological and the spiritual realms. whatever it is that the person is capable of doing in their own way, whether it is prayer, whether it is meditation, whether it is yoga, whether it is other forms of healing. Is what we really need to come up with. Recognizing that if we have to lead a healthy life all the way to the last day of our life, staying productive, staying healthy, staying functional, it is very much possible. I have seen people come back from the brink of the worst kind of diseases just with the utilization of their mental power, psychological power, and the right guidance about diet and lifestyle from the right people at the right time. So starting from our children, recognizing what they need, understanding their symptoms, finding out how they can be better taken care of, what is it that is missing. In our modern day, one more topic that I will cover before I end this talk is the adulteration that we are experiencing in our day-to-day life. Adulteration in food, adulteration in day-to-day items, adulteration in air and water. We all know there's tons of pollutions in there. We do the best that we can taking care of that. And even within that, for my patients with allergies and asthma, I have to figure out new devices and machines that they can run in their house so that at least for the 8 or 10 hours that they spend in their bedroom, they get the purest and cleanest air. Modern science has progressed to that level, has been able to go to that level. But with this adulteration, what I find is that every food, right from the time again that we start in the morning to the time we go to bed, that we are getting exposed to, has something or the else added to it, either to increase shelf life or to increase appeal or to increase looks or to increase its ability to satisfy some taste bud or some type of satiety factor in our brain. And these chemicals again are the type that we often cannot identify what they do in a short term, but in a long term, we know that they are damaging. I'll give you a simple example that has become very common knowledge about the use of carbide in mangoes. That's just a tip of the iceberg. There are different in the US, they found out that even for foods that were labeled as organic foods, officially labeled by USDA, US Department of Agriculture, an average of 22 chemicals were found either within the fruit or on the rind, the cover of the fruit. And out of these, the large majority of them were chemicals that were approved by USDA. Without completely knowing what they do in the long term, can they get accumulated in the body? No studies were there at all. All short-term studies in human beings, 4 weeks, 6 weeks, 12 weeks, 16 weeks, 20 weeks, or in animals. And starting to recognize that what is truly organic, what is truly resources that we can utilize so that we take care of all the energy levels that are there in our body by eating the right foods at the right time in the day, in the right season, in the right format, the way it is prepared, at the right age. We will often find that in a family, what the child in the family is eating, also the grandparent in the family is eating. When in reality, diet changes with age for optimal health. Stressor on the body. What can be digested easily by a 10-year-old cannot be easily digested by a 60-year-old. So coming to realize all these aspects about our health, about our lifestyle, where are we getting exposed to chemicals? Where are we getting exposed to adulterants? How can we detoxify our body? How can we cleanse our system? So that how can we identify from the symptoms that are occurring now, what can we look at in the future? Within modern medicine, with the research that I've been doing in the last 10 years, we have even reached the stage by doing a simple blood test, we can identify the top 25 or 30 diseases that are life-threatening, which of them a person is at risk of getting in the future. So modern medicine can go to that extent. And then trying to identify what you can do to protect yourself or prevent yourself from getting that is far smarter than waiting to end up having the disease and then having to treat it. So hopefully within this talk today, as I have mentioned a lot of different things, given you all an insight into the areas that you all can actually look into for your own life, about where all of these stressors come in, how they are affecting you, which stressors are modifiable, which are not modifiable. If they are not modifiable and you know you have to deal with it, how can you best deal with it so that you increase your ability to cope with stress? Our ancestors had a lot of ability to cope with stress. We've lost our ability to cope with stress because our immune systems, our nervous systems have gotten weaker over time. Identifying what is right for our body to eat, when to eat it, how to eat it, why to eat it. Simple changes like that can go a very long way in keeping us healthy till the very last day of our life. Very productive, successful, with a balanced mind, the definition of health as World Health Organization gives, not just absence of disease, but complete health, physical, mental, emotional, and spiritual. That's the WHO definition of health. I can tell you as a practicing doctor myself, I can hardly get past the first two within the time that I have with my patients. And so it has taken a lot of commitment, a lot of change, a lot of alteration in my way of approach, dealing with patients, identifying who are truly awakened and want to go to the core of their disease, resolve it so that then they can look at life beyond that. Because if someone is stuck in survival and physical health, they will never be able to go to the next realm of emotional, psychological, spiritual health. They'll get stuck in techniques that they may follow for the entire life and yet not be able to achieve the results that might have been promised by Patanjali or by Buddha. Because there's a difference between a technique and the technology that's behind it. So hopefully today's lecture, I know as Rotarians, you all are in a very good position in our society to be able to make a change starting within yourselves, with yourselves, and also to your families and everyone else around you. Hopefully this lecture has been an eye-opener so you all can assess and see not just modern medicine in terms of learning new information, learning new technology, learning about new devices and medicines, but actually about looking within to find answers and taking the right guidance and help to follow the right diet, the right lifestyle, the right detoxification of the body in a timely fashion to keep a healthy, balanced immune system, which ultimately is at the source of every single disease. Every disease is ultimately at some point or the other manifested or acted upon through by the immune system. So with that, I thank you all for your attention and your time and for inviting me to speak to you all this evening.